Hi, this is Landy with Peak Possibilities, and today I want to talk about why your pelvic position is important for your pelvic floor. So there's kind of three main ways that our pelvis tends to reside. We have what's called a neutral pelvis. So it's nice and centered. We have an anterior tilt where we're tilting forward, and a posterior tilt where you're tipping back and tucking your bum. So the ideal is that nice neutral pelvis. Now, why does this matter? Why does it matter that we have an anterior tilt, a neutral, or a posterior tilt? Well, that neutral pelvis gives your pelvic floor the most support. So that's every muscle can contract more evenly, we can work together. That's the ideal position. Oftentimes during pregnancy, women adapt to use a tilted pelvis to help compensate for the weight of the belly. So the two main ways that women do that are that anterior tilt, and so you see that kind of duck waddle, the belly's way out here. That tilted pelvis can put a lot of pressure on that front of your abdomen. It can create a larger diastasis recti, that split in your abdominals, and it causes a lot of pressure here, and all of your pelvic organs and baby are all pushing out against your abdominal wall. Now your posterior tilt, so tucking your bum, that's another one that you see pregnant women do, and you have kind of that lean backward. This is another one I see a lot of moms do when they're baby wearing, because you have the weight of the baby, your carrier is not tight enough and adjusted well to you, and so you end up tucking pelvis and leaning back. So the tuck pelvis, lean back is very common, pregnant as well as having carrying a child. Now, why is this one a big deal? Well, as you tuck that pelvis down, all of your pelvic organs are now shifted backward. So there's more pressure down on your vaginal canal. Now that's a big deal because pressure down on your vaginal canal can increase the likelihood of leakage. It can increase the likelihood of prolapse. And so a lot of pressure downward is what we're trying to avoid. We want pressure to come up and in and be able to be regulated. So check out in the mirror. What do you think your pelvis is doing? And you can play with it. Tip forward, tip backward, find neutral. Tip forward, tip backward, find neutral. So if you're having trouble figuring out where neutral is in your body, get in touch with a pelvic therapist, and they can help you figure out what neutral looks like in your body and help you rebalance any imbalances. Talk to you soon.